Stroke is a cerebrovascular disease, which is an interruption of blood supply to any part of the brain. A stroke is sometimes known as the brain attack. It causes a lack of oxygen and essential nutrients to the brain. It causes approximately 2 million brain cells to die, accounting for 11.9% of all the deaths, making it the second leading cause. Stroke is a medical emergency. So let's look into it. How to prevent and how to recognize. Stroke is either caused by a blockage or a rupture of blood vessel. So the first type, ischemic stroke, is caused by the blockage of a blood vessel, leading all the way towards a reduced blood supply to the brain. Then comes hemorrhagic stroke, and that is because of the rupture of blood vessel, leading to the bleeding. Then comes the transient ischemic stroke, which is from a temporary blockage, often a warning sign for the future attack. Ischemic attacks account for 88%, making it the most common. Symptoms are usually coming without the warning, and they're usually very sudden. If we talk about the causative agents, it's very important to talk about the most important factor, which is smoking. Smoking basically decreases the oxygen supply, and at the same time it increases the blood pressure, so increases the incidence of stroke. Then we talk about the sedentary lifestyle, because it's going to lead all the way towards the physical inactivity, making people gain weight, which is itself a major factor in causing or increasing the incidence of stroke. Obesity is going to cause the pro-inflammatory environment inside the vessels, leading to the development of potential blockages and leading to the increased incidence of stroke. High blood sugar, as in diabetes, is going to damage the blood vessels, increasing stroke chances. High blood pressure increases the incidence of the rupture of blood vessels and hence the risk. High cholesterol levels lead to the plaque formation, making it difficult for the blood to flow through the arteries. Save a life, and for this it's really important to recognize the signs of the stroke. What is act fast? Each letter indicates a clinical feature or an action to take. For example, F stands for face. Drooping of the face, especially affecting one side of the face, is a very important clinical feature. Then comes A for arm. Arm weakness is a common symptom, and it's also usually unilateral. Then comes the speech. It is going to indicate the sudden speech impairment, slurring, or difficulty in communication. Then comes time, the most important, because every second counts. Time to call and seek the medical care. We need to prevent stroke. We need to stop the prevalence. And for this, it's really important to quit smoking. It's really important to treat the high blood pressure, to control the cholesterol levels, to manage associated disorders, for example, managing diabetes. It's really important. Then comes eating healthy. Stay away from trans and saturated fats. 80% of strokes are preventable, and we need to take some important steps to ensure the prevention. And the most important are these: eating healthy, getting regular checkups for the blood pressure, avoiding smoking, and exercising. If you get yourself moving, you're gonna reduce the risk. So, spot a stroke, save a life. Thank you.